Today I presented some result on the role of the microbiota and the composition of microbiota to the response to cancer patient, melanoma patient treated with immunocheckpoint inhibitor, particularly anti-PD-1. There are many studies that have shown that the composition of microbiota in the patient may affect their ability to respond to anti-PD-1. These studies are quite convincing, even the exact bacterial species are involved and the mechanisms are still not very clear. Still, there is a lot of interest in trying to target the microbiota to improve the response to anti-PD-1. And some of the evidence that the microbiota is actually affecting the response are negative evidence. It's been shown that patients have been treated with antibiotics or take probiotic on their own, they actually respond, they change their microbiota and they respond less to anti-PD-1 therapy. So in the attempt to improve the response to anti-PD-1, we have been following two approaches. One to look at the diet, and one is to do a fecal transplant. In collaboration with the group of MD Anderson, we have looked whether the content of fiber in the diet affect the response to anti-PD-1, and we have been shown that patients that with high fiber diet respond almost twice as much better to anti-PD-1 treatment than the patient with low fiber diet. And we have studied the mechanism of this effect in mice, and we can reproduce this result in the mice. For fecal transplant, we treat the patient with, in collaboration with the University of Pittsburgh, we treat the patient with anti-PD-1 for 12 weeks. If they don't respond to continue to progress, they get treated once with fecal transplant with material from patients that have already responded successfully to anti-PD-1. We have shown that these patients that were continuing to progress after the fecal transplant, some of them seem to respond to anti-PD-1. About half of them respond at least with stable disease. About 20-30% have a partial or complete response. And again, we can reproduce this result in mice and try to understand the mechanism of this success in the patient.